Another question I always get asked is, what is an Apgar score? Did my baby win something? Did they get a prize? An Apgar score is essentially a way that we, as doctors and staff, keeps track of how your baby does within the first few minutes of life. Dr. Virginia Apgar, an anesthesiologist, came up with a scoring system to help her determine if the babies did well and tolerated the anesthesia during labor. Apgar score is made up of 5 different components. A, which stands for appearance or color. P is the pulse or heart rate. G is grimace or a baby's reaction. A is for activity or muscle tone, and R is for respiratory rate. We score them at 1 and 5 minutes of life with a score of either 0, 1, or 2 for each of those components. Then we add the score together. A perfect 10 would be phenomenal. A score above 7 is actually considered pretty good. Now, this score doesn't determine whether your baby's going to go to Harvard or become a rocket scientist or anything like that. It's merely a way for us to utilize to determine whether or not we successfully resuscitated this baby and the baby transitioned during the first few minutes of life.